Hi, everyone. Thanks for joining us today for our Healthy and Sustainable Childcare Environments webinar. We are pleased to be joined by my colleague, Suzanne Schlechte from the Canadian Childcare Federation. Myself, I'm Robin McMillan from the Canadian Childcare Federation. And we also have two experts joining us today too, Lyne Soramaki and Erica Phipps from CPCHE, and they will introduce themselves. But first, we'll get started with a land acknowledgement. So Suzanne, if you could take over and do a land acknowledgement for us.
Absolutely. Thank you, Robin. We respectfully acknowledge that the land on which the CCCF is located is the traditional unceded territory of the Algonquin and Anishinaabe people. We recognize all Indigenous people who were here before us, those who live with us now, and the 7 generations to come. As Indigenous people have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all. Today, these lands continue to be shared territory and are occupied by many diverse peoples from near and far. A treaty is an inheritance, a responsibility, and a relationship. We acknowledge the harms and mistakes of the past and dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. Lyne and Erica, over to you.
Thanks so much, Suzanne, and thank you, Robin. It's a pleasure to be here today. We're really looking forward to this opportunity to share some information with you about healthy and sustainable childcare environments, and are grateful for our longstanding collaboration with the Canadian Childcare Federation. My name is Erica Phipps, and I have the pleasure of serving as the Executive Director of CPCHE, the Canadian Partnership for Children's Health and Environment. And I'm joined in putting together this webinar not only by our colleagues at CCCF, but also Lyne Soramaki, who is a public health nurse with the Thunder Bay District Health Unit, which is a CPCHE affiliate organization. We're also supported by Helen Doyle with the Ontario Public Health Association, who is one of our CPCHE partner organizations. So really happy to be here today and look forward to sharing some hopefully useful and practical information with you. So in recent years, there's been increasing interest and concern about toxic chemicals and pollution and what it all means for our health. These are just a few examples of news coverage of topics such as microplastics, the so-called forever chemicals, lead in drinking water supplies, and how being exposed to air pollution can not only affect our respiratory health, such as asthma, but may also be harming our children's ability to learn. In Canada and elsewhere in the world, there is also increasing understanding about the benefits of access to green space, for example, and heightened public attention to on the need to tackle the climate emergency. Perhaps some of these topics have raised questions for you, or you've had conversations with colleagues or some of the families of the children in your care about some of these issues. During this webinar, we're going to dig in on some of these topics, starting out with some of the reasons that babies and children are more vulnerable to harm from toxic chemicals and pollution. We're also going to share some action tips and explore the role that childcare professionals, all of you, can play in creating healthier and more environmentally sustainable early learning settings for children. We're going to spend some time talking about simple actions that you can take related to plastics, toxic chemicals that can settle from products into dust, as well as some of the ways to make the food supply and the way that we serve food healthier. We'll introduce you to some resources where you can learn more about these topics and hopefully have some opportunity for discussion. So about CPCHE. CPCHE is a collaborative partnership of some 20 organizations from across Canada, including the Canadian Childcare Federation, that have come together towards the shared goal of ensuring that all children in Canada have healthy environments in which to live, learn, play, and grow. For more than 20 years, CPCHE partners have been distilling key messages from the growing body of scientific evidence of how toxic chemicals can harm children's growing bodies and brains. And we do this so that we can help to equip frontline professionals, including childcare professionals, with practical knowledge on ways to reduce day-to-day exposures to toxic chemicals and create healthier environments for children. So this webinar is an example of the collaborative work we do within CPCHE. And again, I'm thrilled to be working with the Canadian Childcare Federation, as well as our colleagues in Thunder Bay and OPHA, and bringing this information to you today. So over the next 20 or 25 minutes, we're going to share some low-cost tips that you can take to make childcare settings healthier and more environmentally sustainable. Along the way, we'll share some knowledge about why it's especially important to protect young children from toxic chemicals and other environmental hazards. And the bonus in all this is taking these steps will also mean a healthier workplace for you as childcare professionals. And it's a great way to model healthier and more sustainable practices for the families of the children in your care. We're going to spend a little bit of time giving you a virtual tour of the CPCHE Childcare Checklist and Resource Hub, which is an interactive resource where you can learn more and ways that you can go beyond regulatory requirements to reduce toxic chemicals and promote sustainability in your programs. We hope that during this session you will feel inspired and also empowered. It's our hope that each of us will leave here today with a commitment to take one or maybe two new actions starting tomorrow or over the coming days and weeks, or simply a commitment to learn some more. So what is the concern? We're going to share a little clip from one of our CPCHE videos. This is the top 5 tips video. And the reason for sharing this clip is to just give you a little bit of information about what it is that makes babies and children more susceptible to the harm that can be caused by being exposed to toxic chemicals and pollution.
Harmful chemicals that stick to dust, fumes from household cleaners and renovation products, chemicals in plastics, and mercury in fish. All of these can have harmful effects on the growing brains and bodies of babies and children. Compared to adults, babies and children take in more toxic substances from their environment because they eat more, drink more, and breathe more for their size. Also, sticky fingers and toys can carry toxic substances that have settled into dust into curious mouths. Development starts in the womb and continues through childhood. The brain, immune system, digestive system, lungs, liver, and kidneys are still being formed as the baby grows up. Because all of these systems are not fully developed, babies and children are at a greater risk from toxic substances. Let's look at the brain, for example. Exposure to toxic chemicals while the brain is being built can harm how the brain is formed and how it functions. This interruption can have lifelong effects on behavior and the ability to learn.
So in 2022, CPCHE and CCCF teamed up with researchers at the University of Ottawa to conduct a national survey of childcare professionals about health and sustainability issues within their programs. Over 2,000 childcare professionals responded to the survey, sharing their experience and views on topics such as indoor air quality, reducing toxic exposures, climate action, greener play spaces, and more. So the findings from the survey reveal that childcare professionals are concerned about a range of issues. Overall, about 2/3 of respondents were somewhat or very concerned about toxic chemicals in products, outdoor air pollution, children lacking connection with nature, climate change, contaminants in food and in water, poor indoor air quality, hazardous chemicals in cleaning, sanitizing, and disinfecting products, as well as plastics such as bisphenol A, BPA, and microplastics. Respondents also talked about the conditions that they were seeing in the childcare settings where they work. For example, about 1/3 reported that there was peeling paint on walls, woodwork, or other surfaces. And as you may know, Older paint may contain lead, which is hazardous to children's developing brains. About 1 in 5 reported having lead in the water service lines in their program. Only about 20% had reported that their program had been tested for radon gas, which is a naturally occurring but carcinogenic soil gas that can build up to harmful levels indoors. 2 out of 5 had reported that their program hadn't yet been tested for radon, and about 38% were unsure. 22% reported that pesticides are used indoors in their programs on a routine basis. Just under a third reported noticeable air pollution or fumes, for example, from renovations or a nearby industry or roadway. More than a third reported being affected by wildfire smoke, a growing concern across Canada in the past 2 years. And about 1 in 5 reported mold or a moldy smell. Respondents also reported on practices that can actually lead to increased exposures to toxic chemicals. For example, about a quarter reported the use of so-called air fresheners, which contain harmful chemicals, including phthalates that are linked to endocrine disruption and other harms to child development. Just under a quarter reported using artificial turf indoors. Those plastic particles can break down and carry with them toxic chemicals as well. Positively, respondents also talked about some of the practices that they're doing that can decrease, that are protective of child health, such as avoiding the use of antibacterial hand soap. Doctors and experts recommend using just regular old soap and water. There is no need, and there's no appreciable benefit of using soaps that have antibacterial chemicals in them. A number, just more than 2/3 actually, we're working towards a fragrance-free environment, again, reducing exposures to the chemicals that are used in artificial fragrances. And just over half we're working on addressing vehicle idling during drop-off and pickup times. So I am, with pleasure, now going to pass it over to Lyne Soramaki, who is going to share some of the tips in the areas that we're going to discuss today. Over to you, Lyne.
Hey, Erica, thank you so much for the introduction, and I'm happy to be here today. Our first area of focus will be related to plastics and why is the concern. So essentially, plastics are useful, but they can also be a source of health risks. And plastics production, use, and waste are associated with numerous challenges, including unsustainable resource use, greenhouse gas emissions, and pollution. Plastics also break down over time into microplastics, which can be found just about everywhere in lakes and in the ocean, in the soil, in our food supply. Or to give them color or fire resistance. And some of these chemicals are known or suspected to harm human health and or the environment. So next slide. So there's ways to decrease our exposure to plastics. And just before we start, going back to the survey that Erica was discussing earlier with the childcare providers, 53% of the survey respondents had reported that children in their program play with toys made of PVC or vinyl, and 43% reported the use of vinyl-covered sleeping mats or cot mattresses, and 22% reported that their programs use sleeping mattresses made out of polyurethane foam. And so in terms of what we can do to decrease our use would be things like choosing safer plastics, namely avoiding plastics with recycling symbols 3, 6, and 7. The recycling symbol number 3 is the one that's related to polyvinyl chloride. And so you want to replace those vinyl toys with safer options. Look for PVC-free and phthalate-free labels. You want to avoid those that say vinyl or PVC on the label. And if you can't find anything on the label, one of the telltale signs a lot of times is avoiding toys and other plastic items that have a strong chemical smell. You probably have smelled that if you were buying shower curtains that were made of vinyl. Once you open the package, it can smell really strong. And so the other thing you can also do is opt for non-vinyl sleeping mats. And if you are using vinyl mats, you want to cover those with washable fabric and dust and bust the areas frequently. In terms of foods we eat, as well as the ways we heat our food and serve and store them, can also have an effect on our exposures to toxic chemicals and the potential to harm to health. Next slide. So in terms of getting drastic with plastic when heating and serving food and drinks, you want to avoid microwaving in plastic, even if the label says microwave safe. You want to allow food, your drink to cool before transferring to plastic serving containers. And also a great tip is also to opt for fresh or frozen instead of canned foods to reduce that exposure to BPA and the replacements that are found when it is BPA free used in the lining of cans. Of the survey again, some of the results that was found was that 45% of respondents reported that staff in their programs heat food or drinks or pour hot food or drinks into plastic containers. Next slide. That about 34% or 1/3 of respondents to the survey reported that their childcare program serves locally grown or organic foods or grows some of its own food. So that's great news. And growing some of foods on site can be a low-cost way to bring organics into your program while creating a great hands-on learning activity for your kids as well that in the program. And you also want to check with your public health to see if the soil might need to be tested for lead or contaminants. And if you don't have like a suitable outdoor space for gardening, you want to consider a container gardening. Other healthy food choices that can help reduce exposures to toxic chemical would also include choosing low mercury fish, such as your rainbow trout, your tilapia or salmon. One easy action that you can make would be if you're serving canned tuna, you may want to just look at the label to see whether it says light or white. And if it does, you would like to choose one that says light instead of white because light tuna has less mercury. And again, also avoiding foods in grease-resistant packaging. And an example of that would be the microwave popcorn in those bag containers. And again, like I mentioned, choose organic when possible. Next slide. The other thing around nutrition too is that good nutrition can also help protect against harm from certain chemical exposures. And so things like having enough calcium can reduce the harm from that exposure. And also, if you provide a diet rich in fiber, that may also reduce the harm from forever chemicals, which are the PFAs, also known as that term. Next slide. And well, in terms of the other tip that we discuss is, busting the dust. And so things related to dust would include dust contains small amounts of toxic chemicals. And a lot of those dust comes from things like products such as plastics, furnitures, and electronics. Dust can also contain lead from old paint, which is common in older buildings. And contaminants that are tracked in from outdoors can also end up in dust. And of course, chemicals found in dust can harm children's health. And so contaminants that are tracked in from outdoors, it's, an easy thing to do by, making sure that you have some actions that you do that you're preventing that from happening. Next slide. And some of those tips would be to reduce as much dust as possible would include frequently damp mop or vacuuming fluid. Routinely remove dust from surfaces with a damp cloth. You don't want to dry dust because that'll just send everything back in the air like our little video tells us. But so a damp cloth is a lot better. And disposing a vacuum bag safely, you want to dispose the contents of the vacuum cleaner in a way where you're not composting that it's just being sent into the garbage. Opt for hard surface flooring, which is easier to keep clean than carpeting or textured surfaces. The other thing I want to also mention not composting the vacuum cleaner bags. You also don't want to be composting things like a dryer lint as well. So that would be another thing to avoid composting. And when we were looking at the survey, some of the reports related to the dust included things like some of the childcare providers reported saying that 26% of them reported wall-to-wall or extensive carpeting in their center, and 23% had reported indoor artificial turf as well. So just things to keep in mind. There's a lot of things we can change. In terms of dust prevention tips, one really easy thing you can do would be a shoes off at the door policy. That really reduces the risks of having that the dust and dirt come into the center. And you also could do things like choosing less toxic furnishings and products. You want to avoid the use of air fresheners and other fragrance products. And it sounded like some of the centers are already doing that, which is great. And using liquid gel and paste art materials rather than powders and sprays. And avoiding the use of sleep mats and other furnishings made out of polyurethane foam or vinyl. Next slide. So I'm going to turn it back over to Erica for the next part of our presentation.
Thanks so much, Lynn. So it's my pleasure to share with you our recently revamped and now online resource, the CPCHE Childcare Checklist and Resource Hub. So the checklist and the accompanying resource hub material is encouraging best practices and policies for healthy and sustainable childcare environments. So it's a menu of options that go beyond the core regulatory requirements to support childcare professionals and actively incorporating various protective measures and sustainability actions in their day-to-day practice, including some of the tips that Lynn just walked us through. And as a reminder, of course, it remains the responsibility of each childcare program to follow mandated licensing requirements along with public health and safety requirements within their respective region and province or territory. So within the childcare checklist, which is on the CPCHE website, there are 9 topic areas. So we're providing a menu of actions within air quality, both indoor and out, tips related to outdoor learning and play areas, indoor learning and play, sun safety, things like sunscreen and extreme heat protections, cleaning and disinfecting products and practices, kitchen and food preparation, including some of the food-related tips that Lynn shared, facility maintenance and office administration, things like gas-powered lawn mowers and also conserving paper and other resources, sustainability and climate action, finding ways to reduce the carbon footprint of our childcare programs, and tips related to really enriching the inclusivity, equity, and accessibility of childcare programs. So if you were to click on one of those 9 topic areas on the web page, you would get, so I've clicked on the air quality topic, for example, here. You would see that there's a number of different subtopics there. So we could choose something related to outdoor air quality, such as the Air Quality Health Index, or pick something related to indoor air quality. So number of options here, the shoes off policy that Lynn mentioned, bust that dust, issues about carpeting and mold, fragrance-free, radon, etc. So in this instance, I've clicked on ventilation, and just to give you a window into what it looks like. So within each of these subtopics, you're going to get a little paragraph that talks about why is this important? What's the issue here? Why is it relevant for children's health? And then a number of bullets about specific actions that we can take. And we've really tried to make them simple, straightforward, low or zero cost whenever possible. And then at the bottom of each of these action pages, there are a number of hot links to Health Canada and other resources where you can learn more and get more of the supporting evidence of why this is important for children's health. So just before I hand it back over to Lynn, I wanted to share a few more results from the recent survey. And this is in particular as we grapple with the effects of the COVID-19 pandemic, which of course continues. I wanted to share some of the learnings from that survey with you. So very positively, about half of the survey respondents reported that their program had taken measures to improve ventilation and indoor air quality in response to the pandemic. So things like opening windows more frequently, using portable air cleaning devices that have HEPA filters or other sorts of high efficiency filtration, 41% increasing ventilation using the building's existing system. But then there were a few that were concerning because they can actually introduce new hazards to child health and staff well-being. So we had just over 1 in 10 of our respondents saying that they were using some sort of fogging device to propel disinfecting or sanitizing chemicals into the air. You can imagine that having chemicals that are meant to kill things in the air column where it can be breathed in is not healthy. So we know increasingly it's really a matter of fresh air filtration, and not spraying chemicals into the air. About 7% reported the use of ozone air purifiers. Health Canada has issued an alert about those. Ozone generating air purifiers can be harmful. Harmful ozone is damaging to the lungs, so those should not be used. And then Health Canada is also encouraging extreme care with respect to UV sanitizing devices because of potential risk to eyes and other hazards that use of UV can introduce. So, really wanting to underscore and share with you that not everything that's out there marketed to sort of make things healthier is actually going to be healthier. So it's really important to educate yourself. If you have questions, reach out to Health Canada, find out what the recommendations are. So the childcare checklist, just to give you a sense of, so I introduced the resource hub. Within that resource hub, there is a specific checklist, and it is, as the name is, it's a resource you can go through and tick off to indicate where your program is at with respect to some of these best practices. So it's everything from like choosing safer cleaning products, moving away from PVC and other types of plastic toys to healthier versions, having a fragrance-free policy, for example, starting a composting program, looking to green your space and make sure children have access to nature. All of these things on the checklist go beyond your core requirements. These are best practices and a way to incentivize, but also track your progress to make healthier and more sustainable childcare settings for the children as well as for yourselves as staff. So it's an online resource. You can complete it all in one go, or if you provide your email address, you can do part of it and then return later on to continue or to update your progress. You can also, through CCCF, doing the childcare checklist, you can get a professional development certificate. So encourage you to check that out. Some childcare programs are using it as a way to, work with their board or engage in conversation with their client families, and parents also may find the resource of interest. So in 2022, CPCHE, together with the Canadian Childcare Federation, and on the occasion of our National Healthy Environments for Learning Day campaign, launched a vision. We are very committed and excited about the great prospects for making Canada a country where childcare settings are really proactively supporting the health and well-being of children, and being part of our shift towards greater sustainability and action on climate change. So we were thrilled to be joined by nearly 50 organizations across Canada in launching this vision statement, which really underscores the really key role that childcare professionals can play in the environments where young children who are susceptible to harm spend time, and where those real health benefits can be supported and encouraged. So this vision is a 10-point vision. I encourage you to check it out. It's on the CPCHE website. It includes things like siting issues, making sure that we're not building all of our childcare spaces right next to, busy highways or other polluting sources. It's some of the near-term things like choosing safer products, cleaning practices, toys, and so forth, testing for radon, thinking about indoor air quality, a whole host of issues and positive issues as well, as such as green space and those sustainability actions. So this is a real framework for us in working with all of you in the childcare sector and collaborating organizations across Canada to really move towards that vision where all kids in Canada are having the opportunity to learn and play in spaces that are really healthy and proactively supporting their well-being. So I'm going to bounce it back over to Lynn for some of our final thoughts about how we start getting the action rolling.
All right, thanks, Erica. Yes, so moving into action, how can we go about, going the next step? And essentially here, the first bullet here says taking a first step. What might better look like? And that might actually mean taking a step back and just kind of thinking about, why am I using what am I using? And so it could be things like, okay, if I'm using air fresheners in my center, do I really need that? So just looking at taking a step back and maybe making it a first step to remove the air fresheners. In terms of thinking into terms of low, medium, high risk, is there something that you can do today to move from high, medium to low risk? And the example I gave earlier about the tuna, the canned tuna, you could, switch over from white to light tuna, and that would actually decrease the risk of mercuries. And so that's like an easy thing that you can do. And when we're talking about taking and celebrating simple, low-cost actions, just to remember that, things don't have to cost a lot of money to make a change in your center. And so if we're looking back at the example about the air fresheners, if you stop purchasing air fresheners in your center, you're already saving quite a bit of money. And so if you that change, and at the same time, you saved yourself, some money as well. And talking and engage others. And so are there opportunities to engage children in your center? And it could be as simple as showing the top 5 tips videos to the children in your center, getting them excited, families as well. In terms of colleagues, you could do the same thing, or you could even in our health unit, and what we did as a campaign at one time was we developed these decals that we put on in front of a microwave that said plastic free zone, and just as a reminder to colleagues using the microwave that they shouldn't be microwaving in plastic. So little things like that you can do as well. And striving for continuous improvement, you like Erica was talking about, using the CPCHE checklist to plan for and track your progress. And then again, if you're not sure how to make some next steps, there's always your public health professional that can help you in terms of what you can do. And that could be things like, the soil remediation, checking for lead if you decide you're going to do a little garden at your center. And so that concludes, our part of the presentation. I'm just going to pass it over back to Robin. Thank you for listening today. Robin?
Hi. Thank you so much. It was so great to get such practical tips that we could apply into our practice each and every day. I think it's amazing that, we can take this issue that for some people may seem very overwhelming and really put it into terms that can help everyone make a difference right away. So thanks so much, Erica and Lynn, for giving us this valuable information. And thank you for joining us today for this webinar. I did want to let you know that you will be receiving your certificates in the mail in a separate email. It will come separately from a follow-up email that you'll be receiving that has some additional resources in it as well. That usually will come within a week of the webinar. So just so you know, that will be coming. And you will be able to access this webinar in a replay version, but you won't be able to get a certificate for the replay version, just for the live event. But you'll be able to access that on both the CPCHE website and the Canadian Childcare Federation YouTube channel as well. There'll be links for that within the follow-up email that you'll receive. So thanks again. And if you have any further questions, really be sure to reach out. We're all happy to answer your questions and any comments you might have. And Erica has left her email right there too. And there's also Helen, another one of our colleagues, who has her email there. So please feel free to forward any questions or comments to us directly as well. So thanks so much, and everybody have a nice day, and get out there and apply some of these tips right away. You'll feel so much better. Thanks so much.
Thank you, Robin.
Bye.
Thank you.